Welcome on the occasion of International Nurses Day 2021. 3,600 seconds, 60 minutes, 24 into 7, 365 days. You kindle the fire of hope and enlighten our world with touch, smile, love and care, even in the nightfall of COVID-19. I, Christy Ambrose, a proud critical care nurse, salute you, my dear warriors. You have worked hard and your generosity I wish to celebrate. Thank you. Thanks a million. Happy Nurses Day. This occasion deserves an integration of practice and theory. We, the staff of Holy Spirit Hospital, under the leadership of Sister Usha Thomas, Director Nursing, are here to support and echo the International Nurses Day theme 2021. A voice to lead a vision for future healthcare with the following sub-themes: resilience of nurses during the pandemic, compliance to policies and protocols, workplace spirituality, and the competency of a nurse leader. Joining us today on the panel are our very own superwomen and amazing personalities from Holy Spirit Hospital, Mumbai. It's time then that I should introduce them to you. So we have Miss Marina Lawrence, Senior Nurse, Sister Vasanthi Varghese, NABH Coordinator, Dr. Supriya Mane, Nurse Educator, and Dr. Sister Lalita Rosali, Associate Professor, Holy Spirit Institute of Nursing Education. I'm super excited to have all of you here, excited about all the amazing conversations that we are going to have today. Join us at the shore of learning. To begin with, we have Miss Marina Lawrence, Senior Staff Nurse, Operation Theatre, Holy Spirit Hospital, to talk on resilience of nurses during pandemic.
The past year has been one of enormous turbulence and upheaval. Nobody has been left untouched by the impact of the global pandemic, and a great change has been forced upon us. From the responses of many healthcare workers having sailed the sea of death of their families, friends, and colleagues to the pandemic monster COVID-19, they continue to give their angelic smile, soft touch, and soothing words, masking aside their pain and march as frontline warriors to serve humanity. The secret of their warrior march is the spirit of resilience. So, demonstrating resiliency doesn't necessarily mean that you have not suffered difficulty or distress. It is the ability to resist being affected or to recover readily from setbacks and adversity. Fundamentally, while health is considered a national asset, there are many different challenges the nurses face with stress-causing burnout. In January 2021, the ICN drew the world's attention to the evidence showing mental health issues and psychological impact on nurses as a result of responding to the COVID-19 pandemic, which has brought the world to its knees. This situation is mass traumatizing and risks damaging the nursing profession for generations to come. ICN estimated a burnout of 13 million nurses by 2030. Can we as healthcare professionals rewrite this estimate by being resilient? Resilience is what gives people the psychological strength to cope with stress and hardship. Psychologists believe that resilient individuals are better able to handle adversity and rebuild their lives after a struggle. A resilient nurse is competent, enveloped with a sense of humor, optimism, coping strategy, spirituality, and hope. Our nursing history provides opportunities to reflect on our resilience and future contributions to healthcare. The COVID-19 pandemic undoubtedly tests our professional resilience. One thing which the COVID-19 pandemic has proved to the world is that when nurses lead, we see positive results. frontiering such brave tasks are seen as a pinnacle of triumph for the resilient nursing fraternity. As the future remains unknown, it is important to appreciate nurses and nursing profession's contributions to Kal, Aaj aur Kal, past, present and future healthcare delivery, and how our contributions reaffirm our professional resilience. As Florence Nightingale said, unless we are making progress in our nursing every year, every month, every week, take my word for it, we are going back. With the words of Henry Ward Beecher, I conclude, hold yourself responsible for a higher standard than anybody else expects of you. Never excuse yourself, never pity yourself. Be a hard master to yourself and be lenient to everybody else. Trust me, resilience at work is a must. It is time to bounce back to cope successfully despite substantial adversity. Can we spread a ray of hope, a hope of resilience? Thank you.
A nurse with resilience is an asset indeed. Thank you, Marina, for communicating a realistic picture on the topic. Our goal is to set gold standards when it comes to compliance. Now we have Sister Vasanti Varghese, NABH Coordinator, Holy Spirit Hospital, to lead us through the compliance to policies and protocols.
Global pandemic COVID-19 has allowed healthcare organizations to call for a reset and the break to abide by policies and guidelines. I presume that you know about various national and international accreditations like NABH, NABL, ISO and JCI, which focus on certain policies and guidelines for safety and quality health for all. Policy in healthcare is of vital importance as it sets a general plan of action, guides desired outcomes, and a fundamental guideline for setting the foundation to ensure safe, quality, and cost-effective care. Although, with the honest and tireless service of the healthcare professionals, the healthcare system has gained huge respect around the world. The policies and the guidelines framed by the Nursing Council of India, Maharashtra Nursing Council, the nursing organizations, and the accreditation bodies should primarily safeguard the interest of these healthcare providers. Let me encapsulate how and why the policies and procedures are important for an organization. Policies and procedures provide a roadmap for day-to-day operations. They ensure compliance with the laws and regulations, gives guidance for decision-making, and streamline internal processes. The purpose of healthcare policy and procedures is to provide standardization in daily operational activities. In my experience at Holy Spirit Hospital as NABH coordinator, lensing the lines of policies and procedures, protocols and standards, it has become clear to me that these policies are essential in providing clarity when dealing with quality in terms of issues and activities that are critical to health and safety, legal liabilities, and regulatory requirements. The healthcare policy and procedures help employees understand their roles and responsibilities within the organization that sets the foundation for the delivery of safe and cost-effective care. I proudly pronounce that nurses' compliance to policies help to shape and refine the quality of care today, tomorrow, and thereafter. One way of improving health services in all sectors is to maintain the prescribed norms and laws by the regulatory bodies. Implementation of these accreditation policies shall certainly improve the quality of nursing care. Visioning the future healthcare, the concept of a nurse practitioner and evidence-based nursing practice needs to be reinforced, which will uphold the respect and position of nurses in society. Similarly, proper and controlled use of information technology would play a wonderful role in raising their performance standards, thus enhance patient satisfaction and organizational reputation. To conclude, a true professional not only follows but loves the processes, policies, and principles set by the profession. Globally, we must acknowledge the selfless hard work of healthcare professionals and their loyalty to abide by policies and the procedures framed that rejuvenates the well-being and welfare of all. Thank you.
Quality healthcare is a result of quality care. I thank Sister Vasanti for an insightful presentation. Quality improvement comes via commitment, sincerity, and love at the workplace. Now I call upon Dr. Supriya Mane, nurse educator, Holy Spirit Hospital, to share her views on workplace spirituality.
The concept of spirituality at work might seem to some like being religious at work. I don't think so. It has nothing to do with religious practices or beliefs. So, what is workplace spirituality? Workplace spirituality, according to Dutchen in 2009, is having compassion towards others, experiencing a mindful inner consciousness in the search of meaningful work that enables wholeness. In layman's term, workplace spirituality is about the discovery of meaning, value and motivation in one's work beyond payments and performances. It is about individuals finding a sense of oneness and togetherness in an organization as a whole. With unforeseen emergencies, disasters, and pandemics, more and more councils, associations, and organizations realize the importance of workplace spirituality and also acknowledge the fact that work can be meaningful to their lives as well. One of the most essential aspects of organizations around the world is living without workplace spirituality. Spirituality has the power to influence nurses who care for the mind, body, and spirit of the patients. It also has the power to influence organizational and societal prosperity with a blend of values. Spirituality is respect, it is communication, it is creativity, it is vision, and it is finding oneself. In its totality, it enhances the employers to incorporate spirituality at work. Quality care is a major concern in the hospital setting. A work environment that supports professional nursing, the spirituality of a nurse, as well as the meaning and purpose a nurse finds in her work contribute to quality care. Although magnet hospitals are reputed to have more favorable work environments and better patient outcomes, the nursing environment continues to be stressful. It can be argued that the stress among the nurses is more than just inadequate staffing, low salary, missing supplies, and also a spirituality crisis. Rome was not built in a day. So, as culture to develop will take time. A sense of community and meaningful work are the most important dimensions of workplace spirituality in healthcare. Nurse managers can enhance it by teamwork and creating an organizational culture which might benefit both the employee and employer. Research studies have shown that the workplace spirituality, for a good reason, enables professionalism, enhances employee empowerment and performance, increases productivity, reduces absenteeism, burnout, and employee turnover rate. Upholding workplace spirituality at Holy Spirit Hospital promotes a sense of goodwill, job satisfaction, and contentment for me personally, which indeed becomes a happy expression of service. In conclusion, I wish every healthcare institution to incorporate and practice workplace spirituality that may help us as a nurse to be connected, compassionate, and contribute towards the betterment of the patient, organization, society, and self. Thank you.
Holy Spirit Hospital, indeed a great place to work. It is my alma mater. Thank you, Dr. Supriya, for an affirmative talk. As we look ahead into the next century, leaders will be those who empower others. For the talk on the competencies of nurse leaders, we have Dr. Sister Lalita Rosali, Associate Professor, Holy Spirit Institute of Nursing Education. Over to you, Sister.
At this point, the healthcare industry faces momentous change ahead, and leaders of healthcare organizations are urged to be ready to adapt and face these changes here and now. To meet these emergencies, the industry needs and seeks exceptional leaders. For resilient leadership is essential to realize the vision of a transformed healthcare system. A profession that adapts to the complex human scenario globally is nursing. Nursing is a scholarly discipline built on the bedrock of science and art, which is dynamic and evolving. It stands tall as a lighthouse of care through the nursing system, nursing education, and nursing practice. Although not every nurse begins her career with the thought of becoming a leader, happening of the present day appeals the nurses to be leaders in the design, implementation, and evaluation of, as well as advocacy for the ongoing reforms to the system that is foreseen. Therefore, leadership from nurses is needed at every level and across all settings. The 2021 International Nurses Day theme is certainly a call for nurses to lead as competent leaders and vigilant advocates for the delivery of dignified human care. This call impregnates the nursing fraternity to produce leaders throughout the healthcare system from the bedside to the boardroom who can serve as full buddies with other health professionals and be accountable for their contributions to delivering high quality care while working collaboratively with leaders from other disciplines. Referring to the Becker's Hospital Review 2017, the competencies that healthcare leaders ought to be gripped for the quality of future healthcare are principally to hold a well-cultivated self-awareness, secondly, to enwrap compelling vision, thirdly, to be a real way with people, and ultimately to ignite masterful execution for sustaining creativity and cultivating adaptability to organizational culture and ethos. So also, the core competency of nurse educator from an unpublished doctoral thesis, unfolding the core competencies of nurse educators in India, carves the absolute veracity that every nurse educator must manage and engage with and for students' learning, facilitate effective holistic learners' development, sustain competency and outcome integrated curriculum effectiveness, motivate and strive for a lifelong professional development and quality improvement. strengthen leadership development and succession planning, foster a culture of research and scientific inquiry, and empower nurse educators for respectful, interpersonal and interprofessional healthcare. These competencies will strengthen the uniqueness of competent nurse educators who can be looked up to as ideal nurses, educators and leaders towards a more effective operation of nursing education, practice and healthcare. Somewhere down the lane, I believe, the leadership competencies recommended by the National League for Nursing, every healthcare professional, exclusively nurse or a nurse educator, need to possess critical sets of competencies that can serve as the foundation for any leadership opportunity and be accountable for improving quality of future healthcare and to be more effective leaders and full partners. Responding to the theme, a voice to lead, a vision for future healthcare, every nurse must find self as well as create an environment to be identified as one of the most trusted source of care, health information, change, growth and quality. Thank you.
Rejoice in your work. Never lose sight of the nurse leader you are now and the nurse leader you will become. Thank you, Dr. Sister Lalita, for your remarkable talk on shaping competent leaders. It's indeed very inspiring. Wow, it has been a wonderful journey with all of you. It was great to hear from you what has been happening in the healthcare industry and particularly unfolding nurses' contribution and their efforts to become competent leaders. To all our viewers, thank you for sharing your journey with us so that together let us paint a clear picture of ideal future healthcare that inspires the healthcare fraternity into action. March on, the journey continues. Thank you.